It's Dr. Emer in West Hollywood, and I'm excited to show you one of my favorite yearly skin tightening prevention treatments, Thermage. There's very few treatments that actually work to really just kind of tighten the skin, to give it a workout, to stimulate collagen production long term so you prevent the aging process. One of them is Thermage, the other is Ultherapy. And those are usually things that are used once or twice a year to tighten. It's not going to give you a face or a neck lift, but it's going to prevent you the need for a face or neck lift earlier on. So people like Jennifer Aniston, Sandra Bullock, J-Lo, Gwyneth Paltrow, my suspicion is they're doing these things regularly to maintain their skin quality and texture and keep it lifted. That's why as they age, we don't see them aging, or they're aging really slowly, because they're doing these stimulation treatments which build collagen and tighten the skin as we age, which naturally you're used to seeing jowls forming, which is the jawline becoming abnormally shaped, the cheeks kind of coming their way down, and folds developing around the mouth, as well as the eyebrows coming down. With Thermage and Ultherapy, you can use these to tighten the skin and kind of prevent that process. So what we do is we literally heat the skin in grids, and we already did our first major grid pass on her right cheek, which is why she's really red. Now we're doing, and she's one of my one of our patients that do yoga, so she literally feels no pain right now because she's so used to holding positions in yoga that the pain of this heat is nothing to her. And we do these grids where we follow the squares and the circles, and then what you saw me doing originally was vectoring. That's a unique approach to using the Thermage, and what we do is we follow vectors that you normally would get that would lift the face in a facelift. We're doing that with the actual machine itself. So normally in the old days when people did facelifts, they pulled everything back, giving a windblown appearance. What we do now are we call vertical vectors. We go backwards and upwards to get the skin to lift itself. Not directly back. You see how I'm curving or arcing upward? This is called a vertical vector. And we want her skin to tighten and lift in that area so that she gets a nice natural looking lifting appearance without anything artificial. Even though it's a non-invasive treatment, it's going to allow her to kind of stimulate the heat in that direction and give us more lifting naturally. And so this is a very natural treatment. I actually combine it with Ultherapy, so we're going to be doing Ultherapy in a couple areas today with this so that we get an even better outcome. I personally like Ultherapy where muscle is the most important, so under the neck and around the eyes. I find you get the most improvement in those areas, so we're going to combine Ultherapy there. And then long term, she's going to do this once or twice a year, but we're going to combine a little bit of Sculptra to build collagen, to seed the skin with collagen producing solution that tells the body to produce more collagen and has the texture and tone improve much more quickly along with the Thermage treatment. So this is a great non-invasive, very natural. No one will ever know. They'll just think as she ages, she's going to stay the same, if not look better. Her friends that don't do this are going to age in their natural way, and they're going to wonder in 5 years what she's been doing. So that's the ultimate goal. Any questions on Thermage over there?
Yeah.
Yeah.
What's the earliest age you can get Thermage at?
Technically, there's no restriction on age. At 19 or 20, you're not going to notice that much. Do you really need to be doing this at that age? I don't know the answer to that, but it could be done for prevention, just like working out. When do you start working out? This is like workout for your skin, so you technically can be doing gymnastics and exercise early on in life. You can do the same thing with Thermage if you have the time and the money to be able to do it.
How often can you do this combination treatment of Thermage and Ultherapy?
Really, I would say twice a year, although some people, if they come in with a lot more sagging and really need a lift, they might be able to do it monthly for 3 months and then twice a year after that. That's if we want to do a really enhanced aggressive skin tightening protocol.
And how long does it last if you do the combination?
1 year, up to 15 months. So this is perfect. You see this perfect diffuse redness? That was great. So now let's turn to the other side. You can now see the grid, which you couldn't see before because we put all the gel on here. The grid has squares and circles. Go ahead, give me lots of gel. and we follow those squares and circles. How was the pain on that side?
It was all right. It was a little
bit near the
warm,
end.
yeah.
That's what I thought. A little bit more. So you want what I call lakes of fluid here to allow the energy to go into the skin safely. You want that conductive barrier between the energy and the skin. And then how do you maintain this, okay? Obviously with exercising, with sun damage, with hormones, you lose volume, you lose elasticity. So you're gonna do things for texture, color, and tone like lasers and microneedling and peels and such to really stimulate more collagen. You're gonna do some fillers to lift the skin in certain areas. But then monthly when you're doing your facials, you should do consistent radio frequency that also tightens the skin. So things like Excellus Ultra, Venus Legacy, Thermi Smooth, those things can be done regularly. Give me more gel. Can be done regularly every month to give a little baby collagen. Remember on that side we need to block, yeah, her eyes, her nose, and her mouth. And that will give you your baby amount of stimulation that will build upon this big amount of collagen production.
And it doesn't hurt, correct?
Well, it does hurt because you have some pain with the heat, but like I was saying, my women that do yoga or are very active in athletics, they don't really have as much pain because they're so used to, or if they've had kids, kidney stones, those sort of things, you're used to pain a little bit. So this is nothing. Everyone thinks Thermage is the worst thing in the world when you read about it online, and then when they do it here, they're like, that's it? You know, no one, they can't even believe that it's really not that bad. So, yeah, a little bit more. So the issue is with that is, you know, you should have a level of somewhere between a 2 and a 4 out of 10. What do you say it is at the beginning and then at the end of each area?
At the beginning, it's a 0.
Okay.
At the end, it's a 3.
Like a 3. Yeah, that's perfect. That's what you want. If you do that, you're not going to get any skin problems. You're going to get a nice production of heat. And honestly, I've had patients that plan to go out after this, give me some more gel there, because they look so lifted and tight right afterwards because of the tissue swelling that they love how they look, plus their brows get really elevated. So now we're following our normal vectors of squares and boxes, circles and squares.
What other monthly treatments you said you recommended with
Well,
this?
my thing is, this is your once or twice a year big skin tightening procedure, and then monthly you're doing things with your facials, your microneedling, your lasers to stimulate more collagen. But on top of that, you want to heat the skin. You want to stimulate it to produce a lot of collagen. So things like Venus Legacy, Excellus Ultra, and even lasers like Aerolase or something called Laser Genesis that deeply heat the skin with YAG wavelength that will further tighten the skin and produce more collagen. Interestingly, those YAG lasers also decrease redness and tighten the skin in fine lines, so you can get really a nice rejuvenation from that combination. So that is Thermage, and we will show you guys a little bit of the old therapy in a few moments when we finish. But thank you, everybody.